My mom was born in 1940 in San Francisco, born to two immigrant parents. She grew up in the neighborhood of North Beach. She loved being outdoors. She loved baseball games. She would listen to the games on top of the roof. And she was a hula hoop champion.
Our mom had fallen, and we found out that she had a brain tumor that we didn't know about, and it was causing a lot of pressure on her brain. So it was recommended that she have an emergency, surgery to remove it. And the hope and thought was that that would relieve some of the pressure and she would recover and go into a recovery rehabilitation facility. And that never happened. And she was miserable in the hospital. One day she looked at me and she said, "Honey, can I go home?" And I said, "Yeah, Mom, you can go home." Colleen Horowitz was our By the Bay health coordinator, and she first came in and let us know that she was going to be visiting us on a regular basis. She was assigned to Mom's case, and she was our angel on earth. She had all the answers that we could possibly need and more.
What made their case, I think, particularly meaningful is that both the daughters were present at her bedside. So not just physically, but emotionally. You're not alone, and there is a team of professionals who know how to guide you through this process with the patient in the front, leading their journey. So each patient's journey is individualized, their goals are individual, and we have a team of professionals that can help unpack those goals and provide support so that they can reach their end of life in a way that they feel is most meaningful for them.
Once you're in hospice care, everything is taken care of. And everything just seemed so much easier than dealing with the hospital. And hospitals obviously have a really important job, but it was like night and day. My sister was able to climb into bed with her, and I was able to sit here and read while she slept, and every time she woke up, we'd look at each other and smile, and I'd try to feed her some watermelon and some water, and she'd go back to bed, and the kids would come over and spend time, and so she knew we were all here. And every now and then we'd be talking about something and she would respond. And so we knew she was listening, even though she was resting and her eyes were closed and she seemed to be asleep. It's comforting to know that people can die with dignity in their homes rather than in a hospital situation.
I think the most beautiful thing is that our mom went out on her terms. It was important that we allow her to make that decision.
Anything we needed, Colleen was there. If Mom was in pain, she would make sure Mom had the right medicines.
The experience that we had with By the Bay Health was unbelievable. It really brought the family together. It gave us an opportunity to have everyone come and say goodbye to my mother. For me, it was just making sure that my mom really felt loved and supported. And we were able to provide that.